Okay. Hello, it's Dr. Kilbane, and I'm here with Kiana, one of our practice members, the mother of one of the kids that we see. And I would love to hear from you because he's had some really beautiful improvements. What was going on when you first came to see us?
So I feel like ever since he was 2 weeks old, we noticed a lot of eczema, and it just got worse and worse and worse. And so eczema was one of the biggest things. But during this process, we've also noticed that he dealt with a lot of other things that, you can't totally see as well. But he also would bang his head against the wall when getting really angry, and different neuro things that aren't really appropriate for behavior. He started developmentally slowing down, I felt like, and then asthma at the time, something I wasn't really that concerned about because nobody had officially diagnosed him because he was so young, but we had to use albuterol, it seemed like every week. Anytime he got sick, it was a big battle of being worried we'd have to take him to the emergency department because he just couldn't breathe. So those are some of the things we dealt with. It was a lot.
It's stressful, right? And
yeah,
up all night itching, and
yep, he would not sleep through the night, not worth anything until we came to the program. And so itching all the time, always uncomfortable, couldn't really focus on anything else other than his itching.
Awesome. And you had what had you tried? Because you did a lot of things before you came to see us.
Yeah, I thought I had tried everything. We definitely did a lot of focus on diet because I just read a lot about that. So we'd switched off of dairy, eggs, and gluten, just completely changed our lifestyle with food. We tried every cream I could think of. Everyone had a suggestion, because they saw how awful he looked. And so we tried any suggestion anyone thought of, and every single cream, spent thousands of dollars on creams, steroid creams, just anything anyone thought of. Other alternative treatments, kind of like NET, which is like that allergy therapy. We spent a lot of money on random things because it was awful.
Yes. And then had you gone to see many specialists, like dermatologists?
No, not really very many dermatologists, because I had this really big fear of just putting him on a high dose steroid for the rest of his life. And so I knew that would be the first thing if I went to see a dermatologist. So I didn't go.
Yes. So what did you find as a result? Like when we started working together, what started to happen?
Just it seemed like, first off, the team was just so positive, and it was a really good environment that I could feel like I could finally just let go and enjoy my child, and they would take care of allowing us to heal. And I just kind of needed to do what they said. So it kind of relieved a lot of stress and pressure, but it also gave us tools like the Dr. Aaron cream. I mean, within the first month, he was almost all clear on his skin. And then we started noticing his healing his gut. Because again, things I didn't really notice before because all I could focus on was eczema. He didn't poop very well either. So after that, his never constipated. He pooped all the time. And finally his poops looked normal because he used to just poop out complete chunks of food. Anything he ate would just come out in his poop. It was not digesting a thing. And so he started to digest his food. We just noticed so many changes so quickly.
Yes, and we're very structured, right, about how we do it. And I think, and you're in the medical field yourself. And so I know that's even more difficult when you're struggling and you're thinking, I should be able to fix this. I should be able to help him. Yeah. But as you know, right, we look at things, we learn about things in the conventional medical world in a pretty disjointed fashion, right? We look at the skin separately from the lungs, separate from the GI tract. And often, kids will have seen all those different specialists, GI, dermatology, allergy and asthma. And so what we learn about in integrative and functional medicine is that it's all about that inflammation, and it's looking at it as a whole. So as we start to work together, and because you'd gone off of some pretty significant, some large food groups, and he was still struggling. So that's where we have to go a little bit deeper, right? And look at the microbiome. And we look, what I always say is, right, we understand as best we can his biochemistry, his physiology, and the way his nervous system is put together. We don't change him, we just change the environment that his cells are in. And so, because one of the things you started noticing, right? I mean, in addition to, so his skin cleared up, he wasn't having to use the albuterol as
No,
frequently,
not once. Like ever since we started this, it was like maybe one time when he got sick, but
which
not
is
once after that.
phenomenal. And he
Yeah.
started growing more, right?
Yes. He went from like being 10th percentile barely to 75th percentile.
Yes. And that's a
Yeah.
huge sign that, right, their cells get into something called the cell danger response, and they're going more towards survival and not toward that growth. And so that's one thing that we love to see. And he also stopped banging his head on the wall, right?
Yes. Yeah. His behavior improved a lot, you know, not as many outbursts and just being able to talk more and actually understand what we were saying, it felt like, and just more there with us, you know.
Yeah, continuing on his developmental growth. And so what would you say, because it's a fair amount of work, right? You had
Yeah.
done a ton of work though before you came. So
Mhm.
I'm sure it had to feel good to start to see results as things were
Yes.
progressing.
Yes. Yeah, we had done a lot of work before. And so, but like if I put all that together and the work after as well, like understanding why we do the supplements and understanding everything as a whole and continuing to work, even though we see improvements, continuing to stay off of that food. um, it does take a lot of effort, but you just see the improvement in your kid. And like I would never change for myself, which is horrible. Like I would have digestive issues, or I noticed I used to have these issues when I was eating these certain foods that I wouldn't change for myself. But the seeing him improve, it just changed everything for us.
Yes.
And now I can more like I can heal and he healed, and it's great.
Yes, and the kids are a good motivator. And the undigested food in his stool, right?
Yes.
That's a big indicator for us that he's got significant amount of inflammation. So if there's undigested food, right, it's not getting broken down and absorbed, and we're not absorbing those nutrients. And especially these little kids who are growing and developing, we need our fats for our hormones and our proteins for our neurotransmitters, and everything in between.
Yeah.
So that's another huge thing that we look at, right? We talk about stool all the time.
Yeah. Yeah.
And so what would you say to any other families out there of of putting the time and effort and the investment into doing something like this? Because it's very different, right, than what you would do in many normal practices.
Yeah. Um, for us, one thing it was especially hard was just the like financial burden for sure. And so but I look back and like people will ask me like, would you do it differently? And me and my husband will talk about it and things like that. And I was like, knowing that this is not something that, just changed us for 6 months or whatever, knowing that this was a lifelong change for him and that we have avoided so many problems in the future just by understanding him and helping him out now. It's way worth it. I mean, the cost that I was putting into conventional stuff before, truly, like now that we won't have to worry about that anymore because we understand his microbiome and we're able to heal that better, it's just made the world of difference. And the education piece is just invaluable. That's something that is never taken away from you. And so yes, I put in all this time now, but education wise, I know so much more going forward if I have future children and things like that for sure.
Yay, yes. And so it's always about blending the best of conventional and integrative. So, right, it's never about one or the other. And that's the beauty. And we see a lot of people who've maybe done a lot of very, very natural. And so we bring them a little bit more this way. And then the same thing with the other piece of it is we might have kids who are doing everything conventional medicine is recommending, but they're still struggling. So we kind of walk that middle ground of bringing both nutrition, gut health, supplements with the conventional.
That's true. Yeah. And that's one thing I have more respect for sure, because I feel like I was definitely trying to stay away from conventional on most of things. And in the long run, like it didn't really support him. And so we needed both. We needed both sides. So, and I'm so grateful for both sides.
Yeah. Awesome. Well, thank you for taking the time out of your day. And
Of course.
I know that sweet little man is he's right near you, taking a
Yes,
little
he's
nap,
sleeping
right?
on me. Yeah, he's sleeping right here.
Awesome.
Finally sleeping.
Yes. All right, great. And we didn't say how old is he now?
He's 2.
Okay.
He
Okay.
turned 2 in June. Yep.
All right. Thank you.
Yeah. Bye.